how do we get this patient ready to basically carefully and properly, in as non-invasive way as possible, to remove these infections away from the body and allow the body to go on its path of dealing with further chelation, detoxification. I mean, how can you chelate? How can you detox? How can you get well when you have breathing issues, lymphatic issues, and infections that are harboring in your jaw? That's impossible.
Not only that, but infections harboring in the jaw can cross the blood-brain barrier, or at least inflammation from those infections cross the blood-brain barrier. And then that can affect the pituitary, or master hormone regulator. It can affect all kinds of different areas of the brain. So we need to work with a leaky gut-brain barrier sometimes as well. There's a lot of work that we as doctors need to do to prepare the patients to see Dr. Panahpour once we've made that assessment with the radiologist. That's
why I'm truly blessed to, it's not like I'm around the corner from you. I'm actually in your clinic. So that's where the magic happens, and of course, both of us being trained with autonomic response testing, we're able to truly at least focus on what the patient needs, what the patient does. I'm not saying that that's just exclusively, of course, there's other markers that we look at also, but I think autonomic response testing done properly also truly helps us. So I truly want to thank Dr. Klinghardt for, again, teaching this to us, and allowing us to advance in it. Dr. Panahpour, are you familiar with the NUN study?
Yes, tell our audience more about it.
Yes, so a NUN study is an ongoing research study that's been going on right now for the past, I would say, almost, 40, 50 years. It's in Baltimore. Basically, there's a convent right across the street from a medical school and dental school. And all these nuns and pastors got their dentistry and medical help free, basically. And at the end, God bless them, when they passed away, they gave their body to science. So they started doing a lot of different research. And of course, as technology got better, they were able to look at things much deeper. Let's say if patients were dealing with any kind of, let's say, breast cancer or ovarian cancer, or any kind of a medical issue, there was a specific part in their brain that was diseased. So let's say breast cancer, there was one area in the brain, ovarian, another spot. And when they looked at these areas in the brain, top 3 things they found. Number 1, mercury. 2, aluminum. 3, biofilm. Now the question was, how did these buggers, these heavy metals, get to that part of the brain? Because there's a blood-brain barrier.
Right.
The conclusion was that these buggers, these heavy metal toxins, can travel through the nervous system. And the closest part to that brain was the oral cavity.
Right.
So I found that to be, and this was actually in the American Dental Association journal, which I'm not a big fan of that organization, but it was really interesting. Even they came up with this research. So I found it to be very interesting. So again, the oral cavity is the gateway to, is the engine, is the gateway to your health.